Okay, so we have Miss Baker. She's a 54-year-old female. She came in complaining of nausea and vomiting and severe epigastric pain for about 3 days. So we took her history. She has osteoporosis or osteoarthritis, and she's been taking 400 milligrams of ibuprofen for about 3 to 4 times a day for the last month. So we did an abdominal assessment. Came with tenderness over her right upper quadrant. She has hyperactive bowel sounds. Lungs are clear. S1 and S2 are heard with no murmurs. When I was done with her assessment, she did say she was going to be sick, and she vomited about 300 milliliters of coffee ground emesis. We went ahead and got an order for Zofran of 4 milligrams IV every 6 hours. I gave her the teaching of why we were getting it, what were her side effects could possibly be. She was alert and oriented when she came in. She did become weak and drowsy. So we did a CBC on her, and it came back with her hemoglobin of 10 and her hematocrit of 31%. So we inserted an NG tube on her with some intermittent low wall suction that was ordered by the doctor. We were watching her, and her blood pressure dropped to 96/60. So we went in and looked, and the canister was halfway full of blood. She then turned pale, diaphoretic, and drowsy. Her heart rate went up to 122. So we went ahead and gave her 2 units of packed red blood cells. So they did go ahead and order a stat EGD, and they found that she had 2 slow bleeding gastric ulcers. So they cauterized those, and then she did have a arterial bleed that they fixed as well. So she is in her room for her post-procedure and observation. No on when she's going to be able to go home right now. But her vital signs when we came in were 99, 122, 28, 96/60. And she did have that tenderness in the right upper quadrant, but other than that, she has not had much other issues. I did educate her on not taking so much acetaminophen or ibuprofen at one time, just because that's basically what is happening. That is the cause of why she's in here. So as of now, she's doing good, but every 6 hours, give that Zofran.